ADHD patients in uncertainty, the NHS shutting out those in need. Imagine feeling trapped in a fog of frustration, where a condition that disrupts your focus and impulses leaves you struggling to function, yet the healthcare system designed to support you is slamming the door shut. This is the heartbreaking predicament facing countless individuals with ADHD across the UK today, and it raises urgent questions about fairness and access in our National Health Service. But here's where it gets controversial. Is the NHS unfairly prioritizing certain patients over others, potentially leaving the most vulnerable behind? By Vicky Loader, Nick Triggle, and Catherine Burns. BBC News. Adult ADHD specialists within the NHS are halting new patient intakes due to overwhelming demand, as revealed by an in-depth BBC investigation. The probe uncovered that 15 local regions have completely shut down their waiting lists, while another 31 have implemented stricter eligibility rules, complicating the path to essential support. In response, Professor Anita Thapar, who leads NHS England's ADHD task force, described the results as disturbing and highlighted the enormous risks these barriers pose for patients. She is set to release her findings in a report this Thursday, which is anticipated to propose a major revamp in how ADHD care is delivered nationwide. To help beginners grasp this, ADHD stands for Attention Deficit Hyperactivity Disorder, a neurodevelopmental condition that influences brain function, often leading to impulsive behaviors and difficulty maintaining attention. It's estimated to impact around 5% of children and 3 to 4% of adults, though a significant portion goes undiagnosed. Proper diagnosis and treatments, like medications that stabilize brain chemistry or therapies that build coping strategies, can profoundly improve quality of life, allowing individuals to better manage their symptoms and thrive in daily activities. Yet, according to NHS data, once on a waiting list, the average delay stretches to 8 years. Now, our investigation shows that numerous areas are further restricting entry to these lists, exacerbating the issue. Through Freedom of Information requests, we gathered responses from 59 services, representing most adult ADHD support providers in England. The key findings include: 15 trusts have suspended all or partial referrals. Some of these cover vast regions and have closed lists for specific locations. In Cheshire, for instance, the adult service has barred new patients since 2019. Among the others, 31 trusts are limiting access by imposing exclusions based on factors like age or symptom severity. Notably, Coventry and Warwickshire Partnership Trust faces potential legal challenges for capping adult assessments to those under 25. And this is the part most people miss: not everyone has equal options when local NHS doors close. In certain regions, GP-referred individuals can exercise their right to choose, allowing them to join another NHS waiting list or seek private care at their own expense. While this provides a workaround for some, it underscores a disparity: those with financial means gain alternatives, while others remain stuck. Our investigation also spotlighted innovative approaches in select areas. Surrey, for example, with over 11,000 adults awaiting help, is testing a program that trains private GPs to conduct assessments and provide treatments, potentially easing the burden. Real stories of struggle. Louise Nichols, a 45-year-old from Derbyshire who suspects she has ADHD, exemplifies the human toll. Her challenges began in primary school, leading to a diagnosis of school phobia and homeschooling. Maintaining employment has been tough, and she expresses exasperation at her ongoing battles. "I need tools to help me perform at my best, be it through meds or counseling," she shares. "I'm eager to secure a part-time role and contribute to my community." Derbyshire lacks its own service, so Louise joined the Sheffield Trust's waiting list for 2 years. However, in October 2023, she was removed because Sheffield ceased assessing out-of-area residents amid surging demand, leaving over 3,700 in Derbyshire in a similar plight. "It's deeply disappointing," she laments. "Why doesn't a national service truly cover the entire nation?" The risks of neglect. Professor Thapar deems these obstacles intolerable, pointing to the historic neglect of ADHD by the NHS. She emphasizes that untreated ADHD isn't minor. Without timely intervention, individuals face heightened chances of complications like mental health crises, substance abuse, joblessness, or legal troubles. Dr. Jessica Eccles from the Royal College of Psychiatrists explains that services are grappling with tough choices as demand exceeds capacity in many regions. Waiting lists are unacceptably long, she notes. Transformations through support. Those who've accessed care often describe life-altering benefits. Sam Stone, 33, near Gloucester, resorted to a private diagnosis via health insurance after his GP rejected it, forcing him back onto an NHS list for validation. He's critical of the convoluted process. It's more like a disorganized maze than a system, where you're constantly figuring out ways to navigate it. Sam, who'd cycled through antidepressants since age 16, now uses ADHD medication. It's like lifting a heavy cloud from my life, it's monumental, he says. But let's stir the pot a bit. Critics might argue that rationing by age or severity is a pragmatic necessity in a resource-strapped system. Yet, could this be masking deeper inequalities, where younger or more severe cases get priority, leaving seasoned adults underserved? What do you think? Is this equitable, or does it demand a more inclusive overhaul? Additional reporting by Elena Bailey and data analysis by Rob England. What are your thoughts? Have you or someone you know faced similar barriers with ADHD care? Do you agree that the NHS needs to rethink its approach, or is private innovation the way forward? Share your views and experiences in the comments below. We'd love to hear differing perspectives.